Welcome to a presentation on diabetes self-management education, presented by
Christiane Demaranen,
Ramona Fontes Lopez.
Sybil Hassan.
Elizabeth Kawana.
Hong Lim.
Abstract. The prevalence of diabetes continues to rise globally, presenting a growing public health challenge. Despite this upwards trend, the percentage of individuals receiving formal diabetes education has declined in recent years, leaving many patients without the necessary tools to effectively manage their condition. DSME plays a critical role in bridging this knowledge gap by empowering individuals with the skills and understanding needed for daily self-care, ultimately leading to improved health outcomes. To maximize its effectiveness, DSME should be culturally sensitive and tailored to meet each patient's personal preferences, lifestyles, and individual needs, ensuring that education is both relevant and impactful. Significance of the problem. Many individuals with diabetes experience fear, frustration, and uncertainty about their health, often due to a lack of adequate education and support. Without proper DSME, adults may struggle to control their glucose levels, increasing the risk of serious complications. Diabetes is a major contributing factor to numerous chronic conditions, including cardiovascular disease, kidney failure, and neuropathy, making effective self-management critical. However, participation in DSME programs remains low, often due to financial constraints, language barriers, and limited access to qualified diabetes educators. Addressing these barriers is essential to improving engagement, support better health outcomes, and reduce the burden of diabetes on individuals and the healthcare system.
Equal questions. In adults with diabetes, how the different modality of diabetes self-management educations influence diabetic outcome for improving self-management behavior, quality of life, and hemoglobin A1C?
Review of literature. A review of 10 peer-reviewed studies published within the last 5 years was conducted to evaluate the impact of DSME on adults with type 2 diabetes. Using search terms such as diabetes, health education, self-management, resources, hemoglobin A1C, quality of life, and self-care behaviors, the review focused on literature meeting inclusion criteria. Adult participants with diabetes, studies published in English, and those specifically assessing DSME outcomes. Studies involving gestational diabetes, type 1 diabetes, or non-human subjects were excluded. Findings consistently demonstrated that DSME significantly improves glycemic control as measured by reductions in hemoglobin A1C and enhances self-care behaviors and overall quality of life. The results highlight the value of structured education using different modalities and access to resources and empowering individuals to manage their condition effectively.
We have organized our findings from our literature review in the table in the middle of the poster. Multiple studies across varying levels of evidence support the effectiveness of DSME in improving clinical, behavioral, and psychosocial outcomes, despite persistent barriers to access. Significant reductions in hemoglobin A1C levels were reported across diverse DSME modalities and program lengths, as demonstrated by 4 out of our 5 research studies. Improvements in self-care behaviors, such as glucose monitoring, dietary habits, physical activity, and medication adherence were also noted in multiple studies, including Williamson et al. And Wilmoth et al. And Zhang et al., with participants reporting enhanced knowledge and confidence in diabetes management. Furthermore, studies by Camargo Plazas et al. 2023 and Wilmoth et al. 2024 revealed that DSME participation was associated with perceived empowerment, reduced diabetes distress, and improved overall quality of life. However, common barriers such as limited health system support, low referral rates from providers, participant-related challenges, financial constraints, language barriers, and restricted access to diabetes educators continue to limit participation and effectiveness of DSME programs, especially in underserved populations. Addressing these systemic and environmental barriers is essential to ensure equitable access and maximize the benefits of DSME.
The Johns Hopkins Evidence-Based Practice Model. The Johns Hopkins Evidence-Based Practice Model supports DSME by encouraging the use of the best research, healthcare provider experience, and patient need to guide care. This approach helps ensure that DSME programs are effective, personalized, and improve the overall health and well-being of people with diabetes. This model helps guide the decision to make sure care is based on strong evidence at what works best for each individual. By following this approach, DSME program can be more effective, patient-centered, and lead to better health outcomes such as improved blood sugar control, increased confidence in self-care, and a higher quality of life for living with diabetes.
Literature review outcomes / evidence-based solutions. Despite its benefits, several barriers prevent adults from participating in DSME. In a consensus paper by Powers et al. In 2020, it cites 4 different major barriers to achieving diabetes education as the following. Number 1, health systems. Number 2, referring providers. Number 3, participant-related issues. And number 4, environment. Many individuals do not receive a referral from their healthcare provider, while others struggle to find the time to attend education sessions. In a study by Thurakin et al., only 5,722 of 56,638 adults with diabetes received a referral for DSME, and of those, only 2,177 completed the program. Additionally, financial constraints, language barriers, and limited access to diabetes educators further reduce participation. The Level A recommendation emphasizes that DSME should be tailored to patients' cultural and personal preferences and needs, specifically citing telehealth or other digital options to overcome access barriers. Expanding access to DSME through telehealth options, workplace wellness programs, and community-based initiatives is essential. Ensuring that DSME is accessible and widely integrated into routine diabetes care can help more adults gain the knowledge and support necessary to improve their health outcomes and prevent complications. Caring for an increased number of people who have a complex and time-consuming chronic condition requires the healthcare worker to consider how this will impact the healthcare system and society at large. A typical primary care visit lasts 18 minutes on average, and given the wide range of diabetes self-management required for positive outcomes, it's unlikely that DSME can be effectively addressed during such a brief visit. DSME has been shown to produce meaningful clinical and behavioral outcomes among adults with type 2 diabetes. According to the CDC, DSME is associated with an average reduction in hemoglobin A1C levels of 0.55%, along with improvements in diabetes-related knowledge, glucose monitoring, and self-management behaviors. Beyond clinical measures, DSME positively influences participants' quality of life, fosters a greater sense of empowerment, and helps slow the progression of diabetes-related complications. Findings from various DSME approaches also indicate that participants consistently gain valuable guidance and access to resources that enhance their self-care habits and overall diabetes management.
Dissemination and evaluation. To enhance the effectiveness and reach of DSME, implementing varied patient-centered modalities such as multi-tools, peer support, and culturally tailored interventions should be adopted as a standard practice change. These approaches not only promote engagement but also support sustained self-management and improved long-term health outcomes in adults with diabetes. Ongoing evaluation is essential and should include customizing DSME to meet individual needs while continuously monitoring health outcomes related to diabetes complications. This ensures that interventions remain relevant, responsive, and impactful in addressing the diverse challenges faced by individuals managing diabetes. The ADA Standards of Care 2025 emphasize that individuals can benefit from self-management education and support at several points in their lives, to include at diagnosis, when life changes occur on an annual basis or when target goals are not being met, and if diabetes-related complications develop. This recommendation legitimizes the importance of ongoing education at critical junctions within a person's life. Over the lifespan, a patient may have different needs depending upon when they access the healthcare system for DSME. In the following slides, you'll find our references list. That concludes our presentation. Thank you for listening.